If you are like many of my patients, when you are doing really well on your hormone therapy regimen, meaning you're getting lots of benefits from it, little or no side effects, the next question that often comes to mind is, well, for how long can I take this for? And a lot of women ask that because they may remember a time where you were taken off your hormone therapy after a few years. Since that is no longer the case, in this video, I'm going to talk to you about how long you can take hormone therapy for, how to decide what's best for you, and have a really good conversation with your doctor. Hi, if you don't know me, I'm Dr. Heather Hirsch. I'm a menopause expert and member of NAMS, which is the North American Menopause Society. And what is really interesting to know is that the pendulum has swung on the topic of hormone therapy over the last 30 years. In fact, in the 80s and 90s, the American College of Physicians advocated for the use of hormone therapy, and women routinely stayed on hormone therapy for many decades. After the results of the Women's Health Initiative in the early 2000s, however, this all changed. And if you want a really deep dive on that topic, check out this video I did here all about the Women's Health Initiative. But when that came out, it scared a lot of women about hormone therapy, and there became this ingrained idea that if you absolutely are suffering and you absolutely must use hormone therapy, you must use the absolute lowest dose for the shortest duration of time. Things have really changed since then. In fact, in 2015, you can see that actually the North American Menopause Society came out with a position statement that says the opposite of that the length to use hormone therapy should actually be shared decision making between you, the patient, and your clinician. Now, many patients and clinicians certainly remember a time when you had to stop your hormone therapy just because you had a birthday that ended in a 0 or a 5. And I'll tell you the reason for that. But what we now know is that just because you have a birthday does not mean we need to take you off, or make you wean off your hormone therapy. So you may say, well, why? What changed? And a lot of it has to do with the Women's Health Initiative study. What they found actually is that women who are within 10 years of menopause, the benefits of hormone therapy vastly outweighed the risks. If you are 1 decade since your last menstrual period when you started is a key word here, there was a null effect on cardiovascular risk factors. And if you were 2 decades when you started hormone therapy, meaning on average you were age 70, then the cardiovascular events or risks of thromboembolic events outweighed the benefits. Now, it's confusing to many people because when the WHI first came out and before the results were adjudicated, meaning looked at by different age, the immediate reaction was, well, in your 60s, there's a slightly higher risk, and in your 70s, there's a significantly higher risk. And so the idea then was, well, when you're 60, you need to come off your hormone therapy. However, what's very crucial is that in the Women's Health Study, that's really when they initiated hormone therapy use. There's actually a big physiologic difference between somebody who starts in the window of safety, meaning 10 years from your final menstrual period, versus someone who started 1 and particularly 2 decades after their final menstrual period. Let me give you an example to make this really easy. Let's say a patient had menopause at 50 and started hormone therapy at 53. She's only 3 years from her last menstrual period. Her body has been seeing estrogen for the last 40 years. We'll exclude before she hit puberty. And it had been 3 years where her body wasn't seeing much estrogen. But when we introduce estrogen again, it's actually anti-inflammatory and a vasodilator. It opens those blood vessels up, particularly the ones around your heart, which is probably why it decreases cardiovascular risks when started within 10 years of menopause. All right, now that same patient, when she has a birthday and she turns 60, let's say she's been on it for 7 years, nothing magically happens because she's been on a low dose of estrogen since that time. And it doesn't become pro-inflammatory at that time. It's still very anti-inflammatory, and she can continue to use it for as long as she would like, as long as she doesn't have any contraindications to estrogen any longer. Let's take a different example of someone who is menopause, was also 50, and now she's seeing you at 62. She's now 12 years out of menopause, and most people might say, well, the timing hypothesis says you should start hormone therapy within the first 10 years. Now she's 12 years out, but let's say she's really suffering. She's tried other options, non-hormonal lifestyle, and she needs a really low dose of systemic estrogen. Now, because she didn't start within the 10 years, that same rule of as long as you need or as long as you would like doesn't really apply here, and she should really consider stopping if she can get over that hump or those particular years where those symptoms are particularly bad, and hopefully they will dwindle down and come up. That's really what NAMS advocates for, is that if you've been on hormone therapy and you started within 10 years of menopause, you can continue it for as long as you like. So how does this play out in clinical practice? Well, I always tell my patients I have two types of patients on both sides of the spectrum and everyone else in between. I have some patients that say, never take my hormone therapy from my cold, dead hands. And I say, as long as you still meet criteria to take your hormone therapy and that's what you would like to do, it's meeting your goals and your priorities, you're up to date with your screening exams, and you don't have any other reason why you couldn't take estrogen, such as having a heart attack or a stroke in that time, you absolutely can. Now, you don't have to be all in, or all out. I have some patients who choose to take hormone therapy for 2 or 3 years, get over that period of time where symptoms are the most severe, and then wean down. When you wean down and eventually come off, one of two things happens. Either you feel well or you have very mild symptoms that you can control with lifestyle and supplements, or your symptoms are really bad again, remind you of exactly why you went on it, and you can choose to go back on it again. And then for everyone in between that spectrum, what I like to do with my patients each year at their annual menopause visit is go over that information with them. I like to ask the following questions. How are you still feeling? Are your health goals being met, the ones that you originally came in to see me with? And is hormone therapy still helping? Does this regimen still fit your lifestyle? Are you up to date with your screening? Any new medications, family history, or diagnoses that I need to know about? And then I help my patient decide what's best for her. So what I want you to take away from this is that ultimately you can decide, as well as with your clinician, about what is best for you. And if you meet all that criteria, it really is shared decision making. And you should never have to come off your hormone therapy just because your doctor says it's time or you're of that age. That is not an evidence-based reason to come off your hormone therapy. If you guys are super interested in this topic, I haven't talked about it for a while, but I have a course, the Menopause Masterclass, which teaches you everything you ever needed to know, step by step, with guides and worksheets and online live classes with me, and you can check that out in the link in my description below. I hope this video was really helpful, and if any of you watching have friends who were told they just had to come off their hormone therapy, or your doctor is trying to take you off your hormone therapy without you wanting to, definitely comment below and let me know what was the major takeaway point for you. Let me know what else you guys want to learn about, and thank you guys so much for following me here on YouTube. If you've watched a bunch of my videos and you haven't subscribed, consider doing so. It's free to do so. You can always change your mind later, and it tells the YouTube algorithm that this is an amazing place to be on the corner of YouTube to learn everything about evidence-based medicine surrounding midlife and menopause. All right, guys, with that, I will see you next week for a brand new video. Bye, everyone.